Health is like money. We never have a true idea of its value until we lose it. Greetings to everyone. October, the month of health literacy, is knocking on our doors again, reminding us that health is not valued until sickness comes. I would like to ask you two questions. Just answer them for your own selves. My first question is, how often do you go to a doctor even if you don't have any ailment? My second question is, do you take your cars for servicing when its servicing is due, even if it is working perfectly well? The answer to these two questions gives us an insight how we take our health for granted. Keeping this in mind, now let us focus on one very important aspect of health, that is infection prevention. So let's get started.
So firstly, let's see what infectious diseases actually are. Infectious diseases are disorders caused by organisms like bacteria, viruses, fungi, or parasites. Many organisms live in and on our bodies. They are normally harmless or even helpful, but under certain conditions, some organisms may cause disease. Infectious diseases are a global problem and in the past used to be the leading cause of death. Smallpox and measles viruses are amongst the oldest viruses that infect humans. There were large pandemics of TB, cholera, and plague that caused millions of deaths around the world. And as we all know about the present pandemic of COVID-19, which has infected more than 35.8 million people around the world. Examples of some other common infectious diseases are chickenpox, common cold, HIV/AIDS, malaria, pneumonia, polio, tetanus, tuberculosis, and measles.
Let's talk about how do people get infectious diseases. Infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, parasites, or fungi. The diseases can be spread directly or indirectly from one person to another. First, person to person contact through skin wounds. Second, droplets in the air, for example, when an infected person coughs or sneezes. Third, food and drink contaminated by stools or urine. Fourth, insects via their bites or direct infection. Some insects help in the transmission of diseases by carrying the infectious agent. For example, malaria, dengue fever, and yellow fever are the diseases spread by mosquitoes. Fifth, sexually transmitted infections, STIs. Diseases like human immunodeficiency virus (HIV) infection involves an exchange of body fluids, usually through unsafe sexual activities. Some STIs may also be transmitted through transfusion of blood and blood products and contaminated needles and syringes.
So let's see how can we control the infectious diseases. Wash your hands often. This is especially important before and after preparing food, before eating and after using the toilet. Wash your hands with soap and water thoroughly and frequently. Get vaccinated. Immunization can drastically reduces your chances of contracting many diseases. Keep your recommended vaccinations up to date. Use antibiotics sensibly. Take antibiotics only when prescribed, unless otherwise directed or unless you are allergic to them, even if you begin to feel better before you have completed the medication. Be smart about food preparation. Keep counters and other kitchen surfaces clean when preparing meals. Refrigerate the leftover food. Don't share personal items. Use your own toothbrush, comb, or razor blade. Avoid sharing drinking glasses or dining utensils. Cover your nose and mouth when you sneeze or cough. Avoid contact with sick people or sharing personal items with them.
Infection prevention of COVID-19. The best depiction of the importance of infection control and prevention has become a live example with COVID-19. With the total deaths risen to 1.06 million worldwide, the knowledge of preventing further spread of this virus has become need of the hour. It is crucial to know and follow appropriate precautions so as to protect ourselves and others around us. The basic precautions being cleaning your hands often using soap and water or an alcohol-based hand rub. Maintaining a safe distance from anyone coughing or sneezing. Wearing a mask when physical distancing is not possible. Avoid touching your eyes, nose, or mouth. Cover your nose and mouth with your elbow or a tissue when you cough or sneeze. Stay home as far as possible. If you have a fever, cough, and difficulty breathing, seek medical attention. This pandemic has brought many changes in our lifestyle throughout the year 2020. Though it has caused great loss to human lives, economy, education, etc., it has taught us all something very important. Prevention is better than cure.
With the spread of COVID-19, the whole world is fighting it together. It is very important for all of us to take care of our health and boost our immunity. So there are some points that I'm going to share with you all today. Point number 1, we can take immunity boosting foods such as spinach, broccoli, sweet potatoes, carrots, green leafy vegetables, and many more. Point number 2, maintaining a healthy weight by being physically active throughout the day and not eating anything unhealthy. Point number 3, it is very important for all of us to take 7 to 8 hours of sleep to maintain a healthy lifestyle. Point number 4, one of the best way to increase our immunity is to stay hydrated all day. Point number 5, there are activities that will help us manage our stress level, which includes meditation, exercise, journaling, and yoga. Point number 6, one of the most effective way to increase our immunity is to work out in the morning and practice different yoga asanas like Bakasana, Shalbhasana, and Tadasana.
After hearing my friends on infection prevention, I'm quite sure you all must have realized the importance of healthy citizens and what an asset they are for a nation. So let us pledge to take precautions, boost our immunity, and become healthy, responsible citizens to the great nation, India. Jai Hind.